My next guest is Congressman Rodney Davis of Illinois. He is a member of the Rare Disease Caucus that works to bring public and congressional awareness to the unique needs of the rare disease community. And I spoke with him earlier this week. Take a listen. Congressman Davis, Republican of Illinois, joining us from his office here in Washington, D.C. And I want to put a number on the table to begin this conversation. 7,000. That is the estimated number of rare diseases in this country. When you hear that number, when you see that number, your reaction is what?
7,000 too many. And my family is impacted by rare diseases. My wife is a 23-year colon cancer survivor. And she was diagnosed after the fact, after she had been treated and gone through surgery with a disease called Lynch syndrome, which means that we have to monitor our children because there's more of a genetic link to that rare disease. But there's so many people that I have met over my career in Congress whose families have been impacted by so many of those thousands of rare diseases. And this is personal to all of us.
So what was that like for you, for your wife, the process of finding out the cause of her condition and then the treatments available after that?
You know, Steve, I harken back to 1999. I was 29. My wife was 26 at the time. We were newly married just a few years. We had a 2-year-old daughter. And, you know, my wife just was exhausted. She couldn't go up a flight of stairs without being winded. And of course, as the sympathetic husband, I thought she might need to go to the YMCA and work out a little more, but she knew something was wrong. And she pushed her primary care doctor, pushed and pushed and pushed to get the right tests. And I'll be honest with you, that same primary care doctor, who's no longer our doctor, he told her it was in her head one time. She got the right diagnosis because she got a blood test, showed she was severely anemic, and eventually, through her own pushing, got the colonoscopy test to determine that she had colon cancer. And then it set off a treatment plan that worked great. She's doing great. But in the end, now our kids, my kids are 25, 21, and 21, and they have to be tested for colon cancer at a much younger age than what anybody else would expect.
So what did you learn about our healthcare system and about treatments available for these types of rare diseases?
Well, number one, the doctor-patient relationship is paramount. That's one of the reasons I ran for Congress. One of the reasons I have continued to advocate for fixing some of the holes in our healthcare system. My wife, if she wasn't able to fire her doctor, she would not have gotten the diagnosis that she got in time to have her colon cancer and her Lynch syndrome based colon cancer be found at stage 2 versus a more deadly stage of 3 or 4. So it's a process here in the United States where we have the ability to utilize our own doctor-patient relationship that allowed us to establish that same relationship with her surgeon and her oncologist. And what it allowed her to do is to get the best treatment possible. And she's now 23 years cancer-free.
So more than 2 decades later, obviously a lot has changed for the better, but what barriers remain in terms of patients and family members trying to really determine the causes or the conditions of these rare diseases?
Well, I think short term, our COVID response in many states has hindered the ability of individuals who are suffering the same thing my wife did to get the diagnostic treatment that they should. I actually argued with our governor and his team when they shut down elective procedures back in the spring of 2020 to get those procedures open again. Because that was about the same time frame in 1999 that my wife was finally diagnosed correctly. And if her colon cancer diagnosis was in 2020, she might not have gotten that diagnosis at stage 2. It may have waited because she was 26. She might not have had the urgency to get that colonoscopy, to get that diagnostic test as soon as someone else. So short term, we've got to change the way that we've responded to COVID, because I think we're going to have an increase in diseases that we know how to treat that are going to have a higher mortality rate. Long term, we've got to keep the doctor-patient relationship paramount. And my fear is that many of my colleagues would rather see a government-patient relationship versus a doctor-patient relationship.
And Congressman Davis, part of the equation is with rare diseases, you don't have a large pool of potential patients. So there's a debate over orphan drugs and how pharmaceutical companies can market those drugs to that relatively small pool who need it so desperately.
Well, when it comes to prescription drug access and in my opinion, the right to try any drug that could possibly help anyone that is fighting a rare disease right now, their access needs to be paramount in what policies we put in place. I was proud to support the Right to Try Act a few years ago that allows patients like my wife or others who may be in a more difficult situation in their fight to have access to those orphan drugs, have access to those pharmaceuticals and those therapeutics that might help that patient survive. We've got to do a better job of making sure that we see where the historic amount of research dollars that we have put forth over the last few years in NIH research money. We have to make sure those dollars are going to research some of these 7,000 rare diseases, because I will never settle for a lack of cures. And what we've seen over COVID is that some of the NIH dollars, we need to do a better job of oversight on where those research dollars are being invested.
I understand your own personal situation with your wife, and so glad that she's doing so well since her first diagnosis in 1999. There is often that odyssey that takes place where you're diagnosed from one specialist, you go to another, you get a different report. It can be confusing. It can make the patient and family members angry and upset. And it often takes years and years to get the correct diagnosis. Why? Why so long?
Well, a lot of times it's based upon the bureaucracy that's been set up in that local provider community. Remember, my wife was misdiagnosed in 1999, told her, our former primary care physician told her that her lack of energy was something that had to do with her mental situation. And we kept pushing. And when we got the right doctors, we got the right diagnosis. But there's also a chain of events that took place. We never would have had an oncologist if he wasn't the hematologist for her first, because they've tried things that will work, that have worked to try and address the symptoms that my wife had. But in the end, those symptoms were always going to remain until she got that final diagnosis. And frankly, when she went in for her colonoscopy, the doctors and the gastrointestinal doctor and the hematologist fully expected to find Crohn's disease, not a colon cancer tumor.
You are on a committee that focuses on rare diseases. Is this truly a bipartisan issue? Do you find the Democrats and Republicans, at least on this issue, come together?
Absolutely. And it's in the results that we've already made in a bipartisan way in investing in historic NIH research funding levels. Again, we've got to do a better job of oversight over how those dollars are being spent, because I don't think they're being dedicated toward the rare disease cures that we need as much as they should.
So let me preface the final two questions, looking at drug companies and then looking at our healthcare system and the role of the federal government. First, your message to pharmaceutical companies working with researchers in trying to find cures or at least treatment for these diseases. Your message is what?
Keep it up. We're the best. We have survivors like my wife because of research that was done decades before decades before our family was impacted by her rare disease. So keep doing what you're doing and keep finding those cures. And if we can be helpful as the federal government, we're going to do that. But in the end, we can't have policies put in place in Washington that will limit our scientific breakthroughs that I know our companies and our researchers and our government can partner together to find.
And of course, those researchers not only include NIH, but also university hospitals that are part of this. So in terms of how we're structuring our research and advice you would give to the process in terms of the federal-private partnership, what would that be?
My advice to researchers would be to focus on the diseases that we know need those cures. Focus on those rare diseases that we know we can have modalities in the future based on your previous research that will be available for patient usage. Understand that we're going to go through projects that have been funded by the NIH with a fine-tooth comb as part of our oversight. So ensure that when you make that request for research dollars, make sure that there is a path to success when it comes to an outcome of curing the deadly diseases that too many families are ravaged by.
And of course, part of that has come through the COVID research and the public-private partnership when it comes to vaccines and treatment. There's also the President's Cancer Moonshot Project. Where do you think that will lead us in terms of this topic that we've been discussing today?
Well, I certainly hope it leads to more cures. I stood up and applauded a former president who announced the Cancer Moonshot. As a matter of fact, I had as a guest to the State of the Union that year, one of my constituents who lost a young son. His name was Johnny Wade. He had a rare form of childhood brain cancer. And his twin brother survived, and Johnny did not survive. And his twin brother was on the floor with me that night up on my shoulders, and I stood up and I watched his mom stand up in the gallery with just the biggest smile on her face, knowing that there were going to be more opportunities for families that may be going through the same thing her family went through, that they might be able to have a better outcome.
Republican Congressman Rodney Davis of Illinois joining us from his office here in Washington, D.C. Congressman, thanks for adding your perspective and your own personal experience to this important issue.
Well, thanks for having me on.